Kinka, thank you so much for joining us and being willing to share your time and expertise. I found my way to you through two recommendations. One was actually Damien's speech therapist who recommended we see a massage therapist who can release the fascia in within his mouth area. And I was fascinated by that because I had heard about releasing the fascia at other times through Damien's physical therapist, who recommended we do it for his feet, as well as his physiatrist, who recommend we do for the whole body. And so you are a cranial sacral therapist and a massage therapist with a background of working with uh, babies as well as young children, correct?
Correct.
Yes. And so I was so grateful to have found you because your expertise, I think, is really rare that you do both the cranial sacral as well as the massage therapy. And I should say, even things like physiatry, I had never heard of. My sister had recommended. And when she first texted me the word physiatrist, I thought it was psychiatrist. And I thought, oh my goodness, already I have to find him a psychiatrist, and he's only 11 months old. What am I going to do? Um, but I have since learned how helpful the physiatrist can be in making recommendations to people like yourself. So thank you so much. And if you wouldn't mind just introducing yourself, kind of your background, your expertise.
Well, thank you so much for having me. It's such a pleasure to work with you and Damien, and also to get to share a little bit about my work, which I really love and feel very fortunate to get to do. I'll share a little bit about my background. So I am a licensed massage therapist in the state of New York. I am a cranial sacral therapist, and I also have a diploma in osteopathic manual practice. That's a training I did in Canada. Um, I first started studying manual therapy about 25 years ago, and I knew immediately that I wanted to work with infants and children. I just felt like they brought so much joy into my day, and a little bit of work could go such a long way because they were still growing and there was still so much change ahead of them. Um, so that was what inspired me early on. And in fact, one of my earliest experiences, which I think about all the time, that also clued me into the potential of working with kids that have special needs was early on in my training, we had to do several volunteer days. And I was studying in New Mexico at the time. And I remember a bunch of us, a big group of us, went to a mall in Albuquerque, and we set up a whole table to offer massage. And I said, I'm really interested in working with children. And I was studying cranial sacral at the time. And a family came up and they had a child with CP, and the child was in a wheelchair. It was a pretty severe case. And they asked me if I would work on their daughter. And I said I would love to. And I really only had just completed my first training. So I was very new in this field. So I approached the child. I asked if I could work with them in sort of a nonverbal way. And then I used the few techniques that I felt really confident with at the time. And the child just relaxed into her chair. And she was nonverbal also. She had just one tear roll down her cheek in this acknowledgement of like, somebody is attending to me in this nonverbal way that I can receive. And the parents were really moved by it. They said they had never really quite seen that before. Something ignited in me that I felt like I wanted to work with all children that I could, infants, young kids, teenagers, and especially kids that had differences going on in their bodies, whatever they might be, because I felt that something powerful had happened, even with a little bit that I knew. So I went on to, especially being interested in children, spend a lot of time working in preconception and birth, actually, because I was so young when I discovered what I wanted to do. And I just felt like I had time and I wanted to understand not just the journey of the child, but what it actually meant for the child to arrive. And that really means beginning with sometimes the mom, and also the pregnancy and the birth process. So I spent about 10 years assisting women during labor, doing bodywork techniques, doulaing, in part to really understand also how the child descends down the birth canal, all the interventions that are present at birth, the risk of different things that can come up at birth, which is obviously relevant to this population as well. So that was a big part of my learning and training. And then I spent some time studying at the Family Hope Center with Matthew Newell, who does a lot of work with children that have different brain injuries or issues like that. And so we looked at it from more of a functional point of view, really understanding the brain. And then finally, I spent my thesis in osteopathic school working with infants and tongue ties. So really understanding what you were saying, the fascia of the mouth, how that connects to the rest of the body, and also the implications for oral function and breathing and airway patency. So that's a little bit about my background.
Which is absolutely incredible because you have so much experience in so many different areas that all touch Damien's challenges. So his challenging birth story, where we had spoken about, there was connections lost within that process of his birth story and your experience of working in prenatally can influence, how those effects, how you can kind of help him post, right? Um, and the other thing that I just want to uh, express gratitude to you for specifically is I think there are a great deal of practitioners that, you make an appointment with them and you have the opportunity to work with them, but you really took the time to come to Damien's other therapies. You said, I don't want to work with Damien until I know that I can help him. And you took the time to sit in on a full OT session, PT session, and really take the time to see the work that they were doing before you took on our case. And that really is extremely rare. And we are just very, very grateful for that as well. So is that something that you normally do when you work with children with special needs or when you're advocating for families with special needs that I know you always do your intake process, but also seeing them in other modalities. How does that infer your work?
Yeah. In general, with children, I like to spend some time doing an intake with the parents when the child isn't there so that we can discuss as many things as we want without the child having to worry about what's being talked about or feeling like the attention isn't on them. Um, and likewise, if there's something that's going on for a child that is maybe a little bit different than I'm used to, or I just want to really understand the process, I like to also get to observe them in another situation. Um, Part of the reason for that for me is that a large part of this work requires the central nervous system to be in a receptive state. And so the more I can focus in on the child when they're with me and give them my attention, the more successful the work is going to be. And if I'm having to sort of dialogue with the parent or gather information while I'm working with the child, it's going to be less effective for them. It also allows them a chance to check me out and be like, is this somebody I'm going to feel safe and comfortable with? And we can kind of feel out in a little bit of a different situation if it's going to be a fit and if I'm going to be able to help them. So that's kind of why for me it's worth the extra effort to understand. I also wanted in Damien's case to understand the OT and the PT he was doing so that I knew what was already grounded and being done and where I could slide in, because I do think cranial sacral or osteopathic manual therapy, they're going to be complementary adjunct services. And so they need to, I really like working in a team approach. And I do that a lot with infants where I'm in touch with the pediatrician or the lactation consultant or whomever else might be working on feeding for the child, because I think that can really benefit the individual if the whole team understands what everybody's role is and how we can support each other.
I'm very familiar with things like Reiki and acupressure, different energy modalities. Could you maybe explain to the people that are listening how cranial sacral therapy works and where it sits in the realm of complementary and alternative modalities?
I will. And I'm going to apologize in advance because it's not a very straightforward answer. I'm going to answer it wearing a couple different hats as a massage therapist, as a cranial sacral therapist, and as an osteopathic manual practitioner. So let me start with the osteopathic piece because I think that's the hardest one to understand. But osteopathic manual therapy actually originated in the United States in the middle of the 1800s. And it's an entire sort of medical discipline looking at the body as a single unit of function with the belief that the body can self-heal and self-regulate, that we tend towards homeostasis when we can. That has become absorbed into the profession that we have in the United States called Doctor of Osteopathy, or DO, many of whom are medical doctors. Your gynecologist, your cardiologist might have gone to a DO medical school and then gone on to train in something else. About 10% perhaps go on to specialize in osteopathic manual manipulation, or OMM. So in the United States, the people doing osteopathic work are medical doctors typically, and they're doing it in that context. And this will come up again later when we talk about payment and how to get these services covered. So that's why I want to take a minute here. In many other countries, including Canada, the UK, and Europe, osteopathy, traditional osteopathy, is considered a manual discipline, and you study manual therapy. So I went to school for 5 years to study manual therapy. And I don't have the training as a doctor. I can't do surgery or prescribe medication. So it's kind of like an issue where the same word is being used in two different ways, depending on what country you're in. But if we look at osteopathy, it really has four different branches, let's say. One is myofascial release, any kind of myofascial work, which we can also, in the United States, put under a massage therapy license, right? The second is osteopathy in the cranial field, which is essentially what cranial sacral therapy was taken out of the medical profession and taught to other professionals like PTs and LMTs and lay professions. So the cranial piece is really looking at very subtle perception and manipulation of the cranium, the cerebral spinal fluid. It's probably the part that looks a little more akin to something like Reiki or energy work, although from a practitioner standpoint, it's actually quite different. But it is working with essentially the central nervous system and looking at any restrictions in this expression of mostly the parasympathetic nervous system. So our rest, digest, and heal nervous system, right? But there's more nuance to it that we can go on. And in the case of somebody like Damien, it's actually rather important because we're really looking at the brain, right? And we're looking at how we can help support neuroplasticity, right? That's extremely important in kids with CP. So that's, I think, where the cranial sacral piece comes in. And again, that can be practiced by an osteopathic practitioner or by a cranial sacral therapist. Another branch of osteopathy is like spinal manipulations and structural work. So that's something you might also see in chiropractics or other bodywork modalities. That's also really important because we're looking at helping kids with gait and mobility and releasing muscle tension or helping to build muscle tone, how they line up in gravity. So while we might not be doing exactly like spinal manipulations, we might be looking at how the pelvis is organized in gravity and how they're able to use their legs, and how we can support that. And the other component is visceral. So working and talking to the organs, making sure the organs are both expressing their motility, their gentle kind of pulsatory motion, as well as how they relate to one another. Are there areas of adhesions, areas where organs are kind of gummy and stuck together? Is there bloating? This is important in this population because for some kids, constipation can be an issue, right? And something that's uncomfortable. And osteopathic manotherapy or visceral manipulation can actually be quite effective in this area. That's something that there's very few studies on all of this. There's a few studies indicating positive outcomes for kids with visceral manipulation or osteopathic manual therapy there. So that gives you kind of like a broad example. And then the other piece is the like psychosocial emotional piece, right? Having a condition that requires a lot of therapy, a lot of extra appointments that might interrupt day-to-day functions can be stressful over a long period of time. And working with the central nervous system can help provide more resilience, more access to emotions. I think any kind of body work, honestly, can be helpful in that regard. But that's another way that we think of it as being able to support kids in general. So there's a lot of different branches to the field and a lot of different people practicing different aspects of those branches. So that's what makes it a little confusing for the layperson to understand it. And that's what makes this a little bit of a long-winded answer. So I do apologize about that.
Oh,
No,
that's a
that's
great answer.
a great answer. And, I'm just thinking through as you're speaking of the sessions that Damien has, because I get to be in on those sessions. And I wonder if you can talk us through, I know you can't speak to every child is so different. So just a typical session, maybe with how you're working with Damien. Because what I'm seeing as a parent, and my husband has observed the same thing, after a cranial sacral session, we notice that his body's more organized, for one. We notice that his left foot, which he has great trouble getting it flat without orthotics, that he's finding his connection to the floor better.
Mhm.
The other thing that we see is sometimes a little bit more emotion is being released. So a few days after a cranial sacral session, he's a bit more sensitive, a bit more emotional. So I see that some things are starting to release. And so all of those things are happening a few days after.
Mhm.
And so, but as I'm in on the session, it's such tiny movements that I can't really gauge a lot of what's happening. I just know something very big is happening. So if you could talk about that awesomeness, that would be great.
Yeah. And you're exactly right. I mean, when you're watching a session, it can look like grass growing, like or paint drying on the wall. It doesn't look like a lot is happening, but a lot really is happening. And that's in part because we're really communicating with the central nervous system and also their proprioception. So where they map their body on their brain, where they feel like they are in space. And for kids, that's even bigger than it is for adults. They're still really in that felt sense. Their bodies are growing all the time. So things are shifting constantly. But a typical session, I think, for example, in Damien's case, there's really two areas that we've been focusing on. We've been focusing on the cranial sacral component, which is often centered here at the base of the neck with me holding his head and working with the area where so much of the nervous system is communicating, both the brain communicating with the periphery and the visceral chain and different areas of the body. So when that area is stuck or restricted, or there's a lot of tension there, then it might impact by a nerve entrapment or tension. It might impact the way they're able to use their bodies. And often we see when that area opens up, there's a lot more organization. So that word that you used is exactly right, is that in general, I find that when the body gets quiet, releases tension, it comes into a better organization with itself. It's almost like closing all the windows and things on your desktop and rebooting your computer, and then everything just works a little bit better afterwards, and you're not exactly sure why. There's a specific technique we often use called CV4. That's a very gentle compression of the fourth ventricle in the cranium. And it has this kind of reset quality to it, where afterwards the whole nervous system just kind of comes to pause, kind of pauses for a moment and then reboots. And it can be very profound, actually. And for any kind of infant or child that may have had some birth trauma, this is an incredibly potent area. And so especially in the beginning, that was an area we focused on with Damien, and we really got to some deeper layers for him. And I think that's when we would see this kind of emotional release afterwards. You know, something to keep in mind is that kids, especially kids like Damien, are working so hard all the time. They are working incredibly hard to speak, to walk, to regulate their emotions, to take in their environment and make sense of it. All kids are, but especially kids that might have additional challenges. And so when we are able to help them organize better, release some of that tension, it just sort of frees up some of this energy that they've been using to kind of block things down or hold things together. It's that feeling of like, I'm holding it together all day, and now I'm just going to like let it go. And that's part of the process, is just, you know, ultimately making things easier, but sometimes there's a little bit of work that has to be done to get there. The other piece that we focused on with Damien is really the myofascial piece. So thinking about how the fascia, which I'm sure people have heard that word, but if you think about it, it's the connective tissue that wraps every muscle bundle, every muscle fiber, every bone, every nerve, every organ in our body, and it's completely continuous. So we are almost entirely enveloped in fascia on every level. And so this is a potent area for communicating across the whole body. And you had mentioned earlier that like working in somebody's mouth might affect different areas in their body as far down as their toes. So having a good ability to get into the fascia system. Now, in the case of Damien, there are areas that are incredibly tight because of the hypertonicity, and the fascia over time is really quite bunched together. And so it takes a lot of repetition. We're going back to the same areas again and again. Luckily for us, he really loves that part and he asks for it. And he asks me, when am I going to use the arnica oil on his feet and his legs? And he rolls up his pants and he lays down. And we actually can use that also to help him get settled and comfortable on the table, so that when I go to do the cranial work, it's a little bit easier for him to lay there.
Yes, it's very helpful that he looks forward to the sessions with you. He will ask about the sessions to you, which is very telling because there are other types of therapies that Damien might say, "Can we not do that again? That hurts," or things like that. But he looks forward to his sessions with you. I think sometimes the thing we find challenging is as things are released, he tends to move a lot on the table.
Mm-hmm.
And so I would say that's probably one of the biggest challenges that you have with Damien is he just wants to move a lot.
And that's a challenge of working with kids in general,
Yeah.
right? So one of the things that happens with especially the cranial sacral part of the work is that it starts to shift the nervous system into a more relaxed state. To a child, they perceive that as starting to feel tired, and they really don't like that because they're busy. They have things to do and places to go and games to play, and they do not want to feel tired. So a lot of kids who actually need the relaxation the most will fight it, especially in the beginning. So some of that becomes just setting expectations, having the parents coach the kid a little bit. You might feel tired. That might not feel so fun, but this is why we're doing this, or you'll feel good at the end of it. Whatever that might be. We also use distractions like stories, sometimes screens if needed, like audiobooks, to help a child just find their way to staying on the table. But generally, it is that sort of shift in the nervous system as they're starting to kind of settle in that they're actually reacting to a little bit. And that is across the board with many, many kids.
the other thing that I was very grateful for is we were able to fund part of your sessions through self-direction, which is one of the few areas where they will fund any type of therapy at all. And so, because we were able to get a doctor's note from the physiatrist, who very specifically wrote the needs for myofascial release, and they don't change their rates very often, so it's like partial.
Mhm.
Um, so that is helpful. Um, can you speak to other ways that parents may be able to fund this type of work other than self-direction? You know, are there insurance providers? I know my sister also has a lot of experience in this area as a nurse practitioner. So um, just if you can kind of both share some ideas of how parents, when there's so much to pay for, how can they how can they fund this work?
So, um, I've learned so much from you about the self-directed funding and all that, and I think it's great. And I think the idea is stay creative because there are probably options out there. But one of the reasons why I wanted to explain the different types of ways this work could look is that there are practitioners out there that might have a DO degree that practice this work, which is generally very well covered by health insurance, or physical therapists that can often be a little bit more covered. I work under my massage license in the state of New York. That's typically not covered by insurance. And so that is a state to state thing. I have seen people with different state insurance get better coverage for somebody with a massage license. I think some of the states out west cover it more. I've also had people who had European insurance for whatever reason, they were able to get things covered. So it is a little bit insurance dependent from that perspective. But I also think many of us who do this work really do it because we love it. And so if you think it's really a good fit for your child, talk to the person that you want to work with, see if there's some way to work something out as well, because we don't want kids who can really benefit from this work to not be able to receive it because of funding issues.
So, one of the other strategies that could be used is to access a healthcare savings account. So the FHSA, and then there are also some other like very high deductible insurances where people have a set amount of dollars that are set aside, and they're able to direct where those dollars go. So through either of those two types of healthcare savings accounts, if you have a prescription from a provider, it can then be utilized and reimbursed.
How how do people find practitioners? Is there websites, things like that, where people can find cranial sacral therapists?
Um, There are a couple of directories that I can possibly share the links to for you.
Yes, that would be great.
Within the osteopathic medical field, those that are practicing more kind of osteo in the cranial field is probably who you're looking for, and someone who also is well versed in pediatrics. And I do believe uh, the American Association of Osteopathy probably has directories on that. Um, in the cranial realm, there are schools like the Biodynamic School of Cranial Sacral Therapy, Upledger School of Cranial Sacral Therapy. They each have their own directories, but for example, Upledger definitely has a training for people who want to work with children and people who are looking specifically at brain conditions. And so there's some specialization there that you could find a practitioner perhaps that works with that. I think probably also the mom network is one of the more powerful ways to find people. So, looking on the appropriate Facebook groups or speaking to other parents, it might be helpful.
What is one thing you might empower a parent with? I mean, obviously, we can't be a cranial sacral therapist. We can't be a massage therapist. We don't have that training. But in between sessions, we see you twice a month. But are there little massage techniques that maybe parents can do? And anything you might recommend?
Yeah, there's two things that come to mind. One is that we often overlook the diaphragm and its importance, particularly when it comes to breathing and taking a deep breath. And any child really can benefit from having that modeled for them. And also at times where they're starting to get dysregulated, where something feels hard, whatever it is, to really come back to, hey, let's take a few breaths together, and teaching your child what it looks like to take a belly breath, to lay in bed and let your belly really expand and then let it out. And I think we overlook it because it's so simple and we breathe all day long and we just can't wrap our heads around just how incredibly powerful this is for the vagus nerve, for the abdominal organs, for the psoas muscle, which is part of how they create their connection to ground and through their legs. And so if there's one area you want to get curious about with your child and develop a years long conversation around, I would say have it be around the diaphragm and the breath. That could mean putting a hand on your child's back or front of their diaphragm. Often we think about the diaphragm just in front, but actually the back is really powerful for calming everything down. That can make them more receptive to learning, to their other therapies, that kind of thing as well. And then the other advice I have for parents, and I even have a little handout on this if you wanted to share it, of just like massage your child. You cannot hurt them. There is nothing bad that can come of it. And developing within the context of the parent-child relationship, experiences of touch that are caring, that are healing, that are relaxing, can be just a wonderful, wonderful part of the relationship that you might have with your child. Every kid is different on how they respond to it. And, it can be something where you're just putting hands on them,
Mm.
just rubbing their back as they fall asleep, you're rubbing their feet. Or some kids really like having massage oil and having their legs rubbed as part of their nighttime routine. It just takes a few extra minutes, but it can be such a wonderful connection point, and pretty therapeutic as well, I think, because it just helps them contextualize what therapeutic touch is and feels like. It helps them develop vocabulary and boundaries around their touch. My daughter is very specific about what pressure she likes, what she doesn't like, how I'm doing it wrong. And she has really trained me to be her perfect massage therapist. She gets very mad when I don't have time for our monthly massage. But that has been over many years helping and empowering her to um, be a little bit directive about what touch works for her body and what feels relaxing to like her leg or her shoulder or something like that. So I think it's an area that can be really enjoyable for parents and actually have quite a lot of benefit. And like I said, I have a little handout that I'm happy to share that just has ideas for ways to make it a game, different age groups, what kind of touch might work best for your child, for an infant to older tweens, so that you can adapt that as well as they grow.
You touched on the vagus nerve. Do you mind speaking to that a little bit? Because I know that has been a big focus in Damien's sessions as well.
Mhm. So the vagus nerve is one of the cranial nerves, and it's called the vagus nerve because it wanders, and it is one of the longest nerves we have in our body. It's primarily the communication between the brain and the digestive tract, but it also has many off branches along the way. Um, and it's part of, it's become a little bit of a buzzword lately, right? Polyvagal theory, all these things, but it's part of our self-regulatory mechanism. It's part of how we come into homeostasis, how we balance ourselves out. And also when we're in fight or flight, when we're responding to stress, we kind of quiet down or turn off that part of the nervous system. And when we're in the vagus nerve and other parasympathetic nerves, the stress response goes down. So it's one of the ways we can sort of access, because it wanders so far throughout the body and it also crosses the diaphragm. That's why a lot of breathing techniques are going to impact the vagus nerve. It's one of the ways we can reduce the stress levels in our body through something kind of more physical and mechanical by working with the vagus nerve. I think it's also incredibly important for receptivity, for learning new skills, for receiving information, for creating emotional connection, right? Is to be in that space more than a stress response space.
You have shared so much wonderful information. The breathing alone, that's something I have to do so much more of. I feel like I'm constantly, like this, and I can definitely model a lot better for Damien, that nice, calm state. If there's one thing that you'd want to share that, you know, you'd like parents to walk away with after listening to this, what would be that thing?
Ooh, that's a really good question. I mean, I think it might be important to just say that the research on this is really, there's not a lot of research, not a lot of studies that have been done yet. And so just for the sake of transparency and to be honest, we don't have good studies that are, saying that osteopathic manual therapy or cranial sacral therapy are going to have these incredible results or something like that. I think there's a lot of mechanisms that we can identify that are potentially really helpful for your child. And so when you're choosing how to balance out your care team for your kid, I think it's definitely something worth considering, especially if you see that it resonates with your child, right? Um, and it's also important to have realistic expectations of what the work can do and can't do. I think that's only fair because there's a lot of demand on parents. There's a lot of extra cost. And so this is a place to kind of tap into your intuition and see, do I notice a difference in their demeanor, in their body afterwards? Sometimes the best way to understand it is to get a session yourself and see what that is like and if that might benefit your child. And then really to keep the communication open with your whole care team so that everybody can be working together to support the whole family as they move through this. And on the flip side, there's so much we don't know about the brain and neuroplasticity and what is possible. I think, kids surprise me and amaze me every single day when we treat a child as a whole being with all of their components to them, their, soul or spiritual part, their emotional body, their physical body, however you want to say that. But when you take the whole being there and really honor that and work with that, sometimes it's amazing what we can see as a result when somebody is met on that level. So I want to hold both of those, I think, just to be fair and honest, but also to say, it could be something that you might really appreciate in terms of working with your child as well.
That is beautiful. And I think, as you were sharing about the expectations, even when you look at a medication, not every medication works for every person. Not every therapy works for every person. There's not one holistic intervention that's going to work for every person, but when it does, it can be miraculous, and it can really complement everything that, it can complement the whole package, right?
I love how you said that a parent should experience it. I was fortunate, maybe when Damon was just a few months old, we did have a cranial sacral session. But it was such a profound experience because she worked on both of us at the same time. And I had never felt Damien so relaxed. Like as a baby, he always felt very stiff. I didn't know he had cerebral palsy at the time. But during that session, I just felt his body just melt and feel so light. And then simultaneously, I had that same release myself. And I just, had a lot of emotion that was released, because we were so connected. Um, and so it was a profoundly moving experience for me. So I definitely recommend that to anybody that wants to experience this work. Thank you so much, Katinka. This has just been so helpful. You've given parents so much to think about, and I truly appreciate all that you do for us and our family and for your time today.
It's my pleasure. Thanks so much for having me and for this wonderful conversation.